Hello viewers, ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. This is Dr. Chandrasekhar, MD Physician Diabetologist. Welcome to my channel Healthy Topics. Today, due to a request by one of my viewer, hypertension in pregnancy, I thought it is very necessary to discuss at this platform regarding the hypertension in pregnancy. BP ಸಿಂಪಲ್ ಆಗಿ ಹೇಳಬೇಕು ಅಂದರೆ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಇನ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಅಂತಲೇ ಹೇಳ್ತಾರೆ. ಏನಕ್ಕೆ ಇದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂದರೆ, ಸೊ ದಿಸ್ ಕ್ಯಾರೀಸ್ ಬೋತ್ ರಿಸ್ಕ್ ಫಾರ್ ಬೇಬಿ ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಮದರ್. ಸೊ ಅದಕ್ಕೆ ಈ ಒಂದು ಟಾಪಿಕನ್ನು ನಾವು ಇಲ್ಲಿ ಡಿಸ್ಕಸ್ ಮಾಡೋಣ. ಸೊ hypertension in pregnancy broadly classified into three varieties. Number one is preeclampsia, gestational hypertension, chronic hypertension in pregnancy. ಈ ಒಂದು ಮೂರು ವೆರೈಟೀಸ್ ಡಿಫ್ರೆನ್ಷಿಯೇಟ್ ಮಾಡೋದು ಪ್ರೆಗ್ನೆಂಟ್ ವಿಮೆನ್ ಅಲ್ಲಿ ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗುತ್ತೆ. ಫಸ್ಟ್ ಕಮಿಂಗ್ ಟು ದ preeclampsia. So preeclampsia is diagnosed in more than 20 weeks of gestation, presence of BP more than or equal to 140/90, presence of proteinuria, and a few lab changes. So proteinuria should be more than 300 mg per day, or PCR, protein creatine ratio, more than or equal to 0.3. So this preeclampsia is very important during pregnancy to diagnose, since it carries risk for both mother and baby. If it is not controlled, preeclampsia can go for what is called as eclampsia, that is generalized seizures. Fits antaralva, adu generalized seizure, and high risk for both baby and mother. So this diagnosis of hypertension in pregnancy is usually done after 20 weeks. ಇಲ್ಲಿ 2 BP ಅನ್ನು ನಾವು ಚೆಕ್ ಮಾಡಬೇಕಾಗುತ್ತೆ ವಿತ್ 4 hours apart. Okay, one patient has come to your clinic, you check the BP, it is more than 140/90, say 150. You're going to check again after 4 hours. ಇದೊಂದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್. ವಾಟ್ ಆರ್ ದ ಚೇಂಜಸ್ ದಟ್ ಟೇಕ್ಸ್ ಪ್ಲೇಸ್ ಡ್ಯೂರಿಂಗ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಫ್ರಮ್ ಪ್ರೀ-ಪ್ರೆಗ್ನೆನ್ಸಿ? ನಂಬರ್ ಒನ್, ಕಾರ್ಡಿಯಕ್ ಔಟ್ಪುಟ್, ರಕ್ತದ ಒತ್ತಡ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಮೋರ್ ದೆನ್ 40% ಕಾರ್ಡಿಯಕ್ ಔಟ್ಪುಟ್ ವಿಲ್ ಇನ್ಕ್ರೀಸ್, ಅಂಡ್ ಪಲ್ಸ್ ರೇಟ್, ನಾಡಿ pulse rate will increase more than 10 beats per minute during late pregnancy, third trimester. But in second trimester, SVR, systemic vascular resistance, will reduce. ಅಂದರೆ ಒಂದು ರೆಸಿಸ್ಟೆನ್ಸ್ ಬ್ಲಡ್ ವೆಸಲ್ಸ್ ಅಲ್ಲಿ ಇರೋದು ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಸೊ ಯೂಶಲಿ ಸೆಕೆಂಡ್ ಟ್ರೈಮಿಸ್ಟರ್ ಆಫ್ಟರ್ 3 months of pregnancy, usually BP should reduce. If you have a BP more than 140/90, it is very alarming sign for both mother and the baby. Coming to the gestational hypertension, second variety, here patient will have BP same more than 140/90, no proteinuria and no hypertension in previous pre-pregnancy state. So this also carries high mortality and morbidity to the baby and the mother. Then chronic hypertension in pregnancy. Here patient will have hypertension before diagnosing pregnancy, and the management for all the three varieties more or less is the same. Why the diagnosing preeclampsia during pregnancy is important? Because around 20 to 30% of these ladies will develop cardiovascular risk later in the life. Kindly remember this. Then coming to the laboratory investigation, we are going to do laboratory investigation. Mainly you remember mnemonic called HELP, HELLP, that is hemolysis, low platelet count, elevated liver enzyme. So this is called as basically HELP syndrome. It has a very high risk for morbidity and mortality. Coming to the treatment aspect, Once you have seen this pre-eclampsia patient, you are going to monitor the BP in and out during the pregnancy. That too, what do I suggest for? I get a cross consultation from obstetrician. So we are going to have a home monitoring BP. So they'll have one book. They need to once before getting up from the bed, they need to record the BP from digital apparatus. So they are going to get this to my clinic. Then I'm going to assess the BP recording. Okay. So at the same time, you are going to advise them about the nutrition part. We are going to discuss separately in hypertension topic when I do that. Then coming to this drugs are very important to control BP in hypertension. Then coming to the drugs part, important drug of choice is labetalol and nifedipine. Labetalol, it is given both IV and oral. Nifedipine, it is given as IV or oral again. Other drugs that can be given in eclampsia is magnesium sulfate given as IV infusion. Why this preeclampsia is very important in pregnancy is the patient, a baby will have IUGR, okay, they will have growth retardation, and the patient, the mother has following the delivery will have PPH, postpartum hemorrhage. Okay. The ಇದು ಬಂದು actually ತುಂಬಾ important in and around, and we see approximately 4 to 10% overall incidence in pregnant women, and nowadays this incidence is gradually increasing due to early screening for preeclampsia. So this preeclampsia, how to get rid of preeclampsia in pregnant women is you have to do the delivery. That is, delivery is the treatment of choice for preeclampsia. However, if suppose patient preeclampsia ಬಂದು ತುಂಬಾ ಸ್ಟೇಬಲ್ ಇದ್ದಾರೆ, BP ಮೇಂಟೈನ್ ಆಗ್ತಾ ಇದೆ, you have to extend up to 37 weeks. After 37 weeks, you are going to take for cesarean or normal delivery based on the indication. Suppose patient has a severe preeclampsia, chances of going to eclampsia, you are going to monitor the mother in hospital. Usually the delivery is done within 34 weeks. Only problem with this is the baby will be prematurity. So you need to admit this newborn in the ICU and take care of the baby for another 3 to 4 weeks. So this is very much burden for the society. So I hope this video helps for all the ladies over there. Kindly do watch, and if you have any doubts, kindly leave anything in the comment section below. Yes, thank you for watching this video. Ellarigu namaskara. Stay healthy, stay tuned to healthy topics. Bye.